In this unit, we will discuss flexibility, its definitions, advantages, and means to improve it using static, dynamic, and proprioceptive neuromuscular facilitation. So who needs to be flexible? Acrobatics and tumbling are popular teams that require extensive flexibility and strength, as seen in this picture. Cirque du Soleil is quite an amazing act that perhaps many of you have seen. Obviously, extensive flexibility is required to maintain these poses. Some people have the unique ability to impress their friends with excessive flexibility, as seen in this picture. And then there's the guy who's probably the life of the party. But then again. So to review, static flexibility are the slow, controlled stretches that elongate the muscle and improve range of motion around the joint. Dynamic flexibility is active, repeated, full-range movements that are replicated during athletic activity. Each exercise is repeated numerous times to increase range of motion and speed of movement. There are factors that affect flexibility: the type of the joint, its shape, and the soft tissues surrounding the joint affect its range of motion. Elasticity is the ability of the connective tissue to return to original resting length after a stretch, and plasticity is the ability to assume a greater length after a stretch. Stretching exercises can positively affect connective tissue by focusing on their plastic potential. Young people tend to be more flexible than older people, and females tend to be more flexible than males. Watch a baby perform a squat. They have perfect form every time, with great range of motion. Muscle-bound athletes may have difficulty with flexibility because of interfering muscle bulk and decreased joint range of motion. And finally, active people are more flexible than inactive ones. However, realize that activity levels alone don't improve flexibility. One has to focus specifically on flexibility to maintain or increase its ability. There can be disadvantages of flexibility, although there are few. First, if an individual has excessive range of motion but doesn't have strength in that range, he or she has an increased risk of sustaining a muscle strain. Second, those with hypermobile joints have a greater risk of arthritis and chronic pain because of the overstretched connective tissue. And finally, it is an interesting fact that those who are hypermobile do not respond well to local anesthesia, and additional medication may be needed. Static stretching is the most familiar method used in stretching. These stretching exercises are systematically used to isolate the muscle groups in the body and elongate them. Force is minimal, bouncing is absent, and because of this, there is less danger of tissue damage. Static stretching also requires less energy and is used to prevent and relieve muscular soreness. There is some research that suggests static stretching diminishes power and explosive potential in the muscles. Dynamic stretching are controlled, active leg and arm movements that mimic functional movements in sport. The movements are initiated with minimal range of motion and progress to maximal range of motion. Dynamic flexibility prepares muscles and joints for activity. Ballistic stretching also includes active leg and arm movements, but brings the muscles beyond their normal range of motion. This is used to increase range of motion required in certain sports, such as judo, acrobatics, and gymnastics. Excessive ballistic stretching may cause increased soreness to muscles and should be used carefully. Proprioceptive neuromuscular facilitation, also referred to as PNF, is a stretching technique where one alters the contraction and relaxation of both the agonist and antagonist muscle groups. The result is a dramatic increase in range of motion. The disadvantage is that some of the exercises require a partner, and training is required to understand the maneuvers. DVD clips will be offered in this unit to demonstrate the commonly used PNF techniques. During static and PNF stretching, the Golgi tendon units, which are proprioceptors in the muscle, are stretched. This allows the muscle fibers to relax. This is called inhibition of contraction. During ballistic stretching, the bouncing movements cause the muscle spindles to activate, which in turn causes the muscles to contract. To summarize this physiology, static and PNF stretching allow the muscles to relax and lengthen during the exercises. However, during ballistic stretching, the muscles can actually shorten and tighten as a result of the bouncing. This occurs to prevent the muscles from being overstretched and is actually a protective mechanism. Refer to the flexibility prescription offered by the National Strength and Conditioning Association. Calisthenics can be used to increase the heart rate and enhance flexibility through dynamic movement. In addition, they increase the core body temperature, prepare the body for activity, and expose the joints and connective tissue to ballistic loads which will be used during physical activity. Calisthenic exercises are commonly used in physical education classes. Boyle recommends that your student athlete first engage in foam rolling to decrease knots and trigger points in the muscles. This is followed by static stretching to increase the lengthening of a muscle. Dynamic warm-up is then initiated to prepare the athlete for the functional movements required in their sport. Boyle emphasizes that any power gains diminished from static stretching will be negated by the dynamic warm-up, and thus includes both static and dynamic flexibility before activity. Boyle also reminds us to properly position the joint and muscle before initiating a stretch. Stretching should not be painful, but just slightly uncomfortable. To activate the antagonist muscle group, as explained with PNF. To include both long static holds as well as active dynamic stretches. To integrate the athlete's body weight to deepen the stretch. And finally, Boyle reminds that overflexibility increases the risk of injury because of the lack of strength available to the muscle. And in fact, it is better to be tight in all muscles than over-flexible in one. In this section, we will systematically review the most common stretching techniques used for the major muscle groups. This may be reviewed depending upon your previous level of knowledge and experience in flexibility. Standing stretches are demonstrated here to stretch the calf, hip flexors, IT band and gluteus medius, groin, and quadriceps. These can be used in addition to the seated exercises, or when you have a large physical education class and you don't want your students to sit on the asphalt or wet grass. These 4 exercises are used to stretch the hamstrings and lumbar muscles from a supine or lying down position. Individuals who have a tight hip flexor will be unable to flex one knee to their chest without having the opposite leg raised from a table or floor. This indicates the need to isolate the hip flexors by using one of the stretches located in this slide. The stretches here are for the quadricep muscle group. The quad consists of 4 muscles that extend the knee and flex the hip. So to stretch this muscle group, it's important that we first flex the knee, as seen in the left picture. However, we also need to extend the hip, which is seen on the right picture. I will demonstrate a self-stretch in the DVD that focuses on both of these movements. You will also learn how to apply PNF techniques for the quadriceps. These are the hamstring stretches. The diagram on the left side is probably very familiar to you. However, the one on the right might be newer. Because the hamstring flexes the knee and extends the hip, and its origin is at the ischial tuberosity, which is located under your gluteus maximus, we need to focus on stretching this top part of the hamstring. Crossing the leg and then flexing the hip while drawing the bottom leg to the chest will stretch the top part of the hamstring. And the familiar V-sit will stretch the middle and lower portion of the hamstring. These are popular seated groin stretches. Notice the lack of flexibility for the man in the right picture. Men are especially tight in the groin and need to focus on this muscle group to prevent injury. In the next 2 slides, we will focus on spine stretches. Remember, we overuse spine flexion during our activities of daily living, including excessive sitting in chairs, driving, and hunching forward. Therefore, we want to focus on extending the spine to counteract this forward tendency. The exercises here will also increase mobility in the hips, which is imperative for low back stability. Here are some additional spine stretches. If the exercise on the left causes increased discomfort in the low back, then it should be avoided. Sometimes student athletes will complain of discomfort from this stretch, often attributed to sacroiliac problems. We will now switch our focus to spine strengthening exercises that can be performed either lying or standing. The goal here is to strengthen the muscles along the spine. Here are some commonly used cervical stretches. Avoid the extension exercise if it causes discomfort. Never attempt to adjust or crack your neck on your own, as it increases joint instability in the cervical spine. Allow a qualified chiropractor or doctor of osteopath to perform cervical adjustments. Now we transition into the shoulder and arms with a few more popular self-stretch and partner stretches. The final 3 slides demonstrate PNF exercises for the hamstrings, quadriceps, and calves. In this slide, 3 exercises are demonstrated to stretch the groin. The exercise on the top left and top right are the preferred methods. And finally, here are a few more exercises to stretch the shoulder and the chest. Refer now to the DVD clips that further demonstrate these PNF exercises in more detail. Refer also to the DVD that provides you an extensive list and demonstration of flexibility exercises to use for your own flexibility and your student athletes.